I can almost sum up my discussion as what they said, but, yeah. My name is Joe Monk. I'm an anesthesiologist. I'm a physician that specializes in the practice of anesthesia, and I'm not nearly as smart as these guys. These guys are all over this healthcare stuff. I'm just a practicing anesthesiologist. But first, I'd like to offer my thanks to Congressman Sessions and his staff for allowing me to come and discuss healthcare from the anesthesiology perspective, kind of the often forgotten specialty. And I greatly appreciate the opportunity to share my concerns. And I am not accustomed to public speaking, and for those of you who have needed the services of an anesthesiologist will attest, we're not typically required to spend a lot of time talking to our patients. So if you'll bear with me a little bit. And I promise this will be my only sports metaphor, but when I was growing up and things weren't working for the team, the coach always took us back to our basics. And the most basic and important components of our health system are patients and physicians. Basically, physicians treating and caring for patients. And in some ways, in this bill, I think the patients did well under this legislation. And I applaud the important insurance reforms included in this bill, such as elimination of pre-existing condition exclusions, guaranteed issuance and renewal, and no annual or lifetime limits on benefits. I think those are indeed steps in the right direction. In other ways, patients did not fare so well. Congress seems to have left out the important second parts of the equation, that being the physicians. And Congress had a historic opportunity to affirm and strengthen the role of physicians in our nation's health system, but the opportunity was missed. Instead of helping physicians and our patients, the enactment of this reform bill represents a continued and pervasive threat to the viability of medical practices, the ability of physicians to deliver care, and ultimately severe limitations on patient access to quality care administered by physicians. Physicians working with Medicare patients have been particularly marginalized. Congress has once again failed to fix the formula used to fund Medicare patients. Because of this failure, payments to physicians caring for Medicare patients will be cut by 21% on April 1st, barring yet another intervention by Congress to stop the cut. And Medicare already funds care provided by anesthesiologists at a rate that's 67% below the rates paid for by Blue Cross and Blue Shield and other health care plans. Medicaid rates in Texas are even lower, and this bill seeks to expand Medicaid programs in the state of Texas. Funding for Medicaid services has long been a problem, and Medicare funding was a problem looking for a solution in this health reform bill. And I repeat, Congress failed, and because of that, failure to adequately fund Medicare will directly translate into greater and greater limitations on patient access to quality, physician-delivered care. And as I've already mentioned, as that wasn't bad enough, Congress has created a brand new commission to reduce Medicare funding for physician services even more. The Independent Payment Advisory Board is a commission that is not accountable to Congress, or by my understanding, the courts either. We cannot support an unfettered new independent authority that could further erode funding for Medicare services and thereby jeopardizing patient treatments for America's seniors and the many baby boomers that are lining up that will soon need full access to Medicare. In my view, access to quality health care through needed insurance reform must carry with it financing that reflects legitimate cost of care and that does not hasten the bankruptcy of Medicare to achieve it. As physicians, anesthesiologists have been able to make incredible advances in anesthesia. Anesthesia is safer now than ever before. And anesthesiologists are recognized as the leaders in patient safety, and this bill threatens the very existence of our specialty. The healthcare law should have provided support and continued efforts to make patient safety and quality care advances through appropriate funding, and Congress failed. I should also point out that the training of physicians working with patients throughout the healthcare system was also ignored. Extremely troubling is the so-called non-discrimination language in the Patient Protection and Affordable Care Act. Our focus as part of health reform should be assuring that patients have access to well-trained and knowledgeable physicians. And this provision suggests that there's no real difference between providers with medical degrees and those without medical degrees. Prohibiting insurance companies from differentiating between education, skills, and training of different healthcare providers is not in our patients' best interests. Finally, just like they mentioned, the bill completely ignores the successes of tort reform in states such as Texas, does little actually to bend the cost curve, and provides little incentive for patients to actually take responsibility for their own health and well-being. There are simply far too many people and too many companies profiting from healthcare in this country that never actually touch a patient or provide care, and it's time to get back to basics.